Superior customer service is very important in our marketplace. You've got to be able to be quiet and listen.
Jerry's reliable, knowledgeable, and he's honest. And if he wasn't, we wouldn't be doing business with him.
I enjoy what I'm doing, so I don't really feel like anything I did is a sacrifice. I think that you need to put in time and effort to be successful. And you know, the pyramid to success is knowing your products, knowing your customer, and knowing the competition.
It was fascinating to watch them work. It was all facilitated by a third-party consultant. And here's a picture of what they think corporate tax looks like today. What jumps out at you?
It's very chaotic.
Isn't it, though?
Yeah.
I mean, you see these silos, almost fortresses. This is tax, this is finance, and that's IT, and the business units are back in the back there. All throwing requests for information at each other, not helping, and very little integration of their activities. Lots of paper flying around, and what the executives who gathered told us is that the amount of risk that they know exists because of how disjointed and competitive the process is within their organizations is really astounding.
My wife and I decided we would go and donate blood. So we went to the Red Cross Center, and they took hers and they turned me down. And they told me, you ought to go to your doctor and let them check you out. So I went to our family physician, and she said, I want you to go see a hematologist, which we went to one of the local hospitals and asked for a name of a hematologist, and they sent us to the Florida Cancer Centers.
Well, I guess we didn't hear that cancer part. And we drove up and we saw this big, beautiful sign that said Florida Cancer Center. And I think like something hit me in my stomach. And I think both of us were a little frightened.
To be transfusion dependent, to me, was a terrible thing. I was always very strong. I lifted weights, very athletic, physically in good shape. And now all of a sudden, I became weak. I couldn't do the exercises that I did. I needed the blood just to be able to function, to walk.
He would make himself sick knowing he had to go through this, and it would sit there for hours and watch the blood drip into his arms. And that hurts when you have to watch somebody hurt like that and you can't do anything about it except say, well, you need it, you need it. And then he'd worry if his veins would collapse. And then how would he have transfusion?
Philly Sport Bar is the place to get together with friends and fans to support every Philly team and enjoy all closed-circuit events. With over 35 TV screens, you won't miss a second of the action while enjoying over 20 beers on tap and an extensive menu, including brick oven pizza. Rain or shine, the deck is always open, so come out for happy hour 2 to 7 Monday through Friday for half-priced appetizers and reduced-price drinks. Don't miss a second of the action at Philly Sport Bar, adjacent to Philly Diner on the Black Horse Pike in Runnymede, New Jersey.
One of the primary considerations in the perioperative management of patients undergoing surgery is the avoidance of ischemic injury to the myocardium. Tremendous morbidity is associated with non-cardiac surgery in patients who are at risk for coronary artery disease.
Beta blockers, both intravenous and oral, have been used for more than 20 years and are beneficial in treating acute myocardial infarction, primarily because they counteract the effects of elevated levels of catecholamines. This opposition to catecholamines has a host of potential benefits. It reduces heart rate and blood pressure, the key determinants of myocardial oxygen demand, leading to less myocardial ischemia, less chest pain, smaller infarcts, and fewer post-MI complications.
Our patients are online, searching for information and a connection to someone at the click of a button. One very important someone is their physician. A recent survey revealed 36% of online health information seekers are frustrated with the credibility of the medical information they find online.
There's, of course, no perfect study, and the large multi-center study of azalastin probably had some deficiencies, but I don't think that one of the deficiencies is the lack of a placebo arm. This was a head-to-head, double-blind, controlled study.
Once total joint replacement has been completed, be it a total knee, total hip, or other joint, the question becomes, what lies beyond? Complications such as infection, prosthetic loosening, dislocation, a level of prosthetic wear that may cause osteolysis. Another study of total hip arthroplasties with a porous-coated acetabular component reported excellent 5-year clinical results. None of the acetabular components required revision because of loosening. None migrated appreciably, changed position, or displayed disruption of the titanium fiber mesh. The performance of the porous-coated acetabular component was judged superior to that of cemented acetabular components after a similar follow-up. Dislocation after total joint replacement is a particularly disturbing complication. An innovative treatment for recurrent prosthetic dislocation is the tripolar hip replacement. This revision procedure uses a large inside diameter acetabular cup and a bipolar femoral component. 8 consecutive high-risk patients with recurrent prosthetic dislocations who received the tripolar hip all achieved stability.
Untreated respiratory tract infections contribute to substantial morbidity and mortality, both in the hospital and in the community. Fortunately, appropriate empiric antibiotic therapy can help prevent most of the potentially serious sequelae of common upper and lower respiratory tract infections. Nevertheless, no treatment program can succeed if the patient fails to adhere to the prescribed regimen. After entering the circulation, Zithromax is widely distributed into tissue compartments and concentrates intracellularly. Bacteria in infected tissue can stimulate the release of high concentrations of Zithromax into the extracellular compartment. In addition, Zithromax is rapidly taken up by phagocytic cells that transport it to the site of infection. After phagocytosis of bacteria, fusion of the lysosome containing Zithromax with the phagosome results in destruction of the pathogen.
This program will supply you and your family with important information on how you can benefit from certain lifestyle changes. In addition, it provides your doctor with weekly information about your health.
Hello? Hello, this is Karen. I'm calling from the telemonitoring program. May I please speak with Mrs. Carter?
This is Mrs. Carter.
Mrs. Carter, has Dr. Richardson told you about our service?
Oh, yes. I've been expecting your call.
Your first 2 contacts with the telemonitoring program will take about 10 to 15 minutes each. Although this will be a little longer than your regular weekly calls, you'll have a chance to gain a clear understanding of how the program works.
Hello, Mrs. Carter. How are you feeling today?
Good.
The reports I've been getting from the telemonitoring program show that over the past few weeks your health has improved. That adjustment we made in your medication has really worked.
Well, I make sure I take my medicine every day, and I try to walk more when the weather permits.
Good. How do you feel about this program? Has it been easy for you to follow?
Oh, yes. I feel much more at ease now that you're monitoring my condition weekly.
Good.
Este programa les ofrecerá a usted y a su familia una información muy importante sobre cómo ustedes se pueden beneficiar de algunos cambios en su estilo de vida. Además, este programa informa a su doctor semanalmente acerca de su salud.
Hola. Hola, me llamo Karen. Le llamo del programa telemonitorizado. Por favor, ¿puedo hablar con la señora García?
¿Soy la señora García?
Señora García, ¿le ha hablado el doctor Richardson de nuestros servicios?
Ah, sí, yo estaba esperando su llamada.
Sus 2 primeros contactos con el programa de cuidados telemonitorizados tomarán de 10 a 15 minutos cada uno. Aunque esta vez será un poco más larga que las llamadas regulares, usted podrá aprender cómo funciona el programa.
Hola, señora García. ¿Cómo se siente hoy?
Muy bien.
Los informes que he recibido del programa indican que...
At Intersys, we talk a lot about being a global company, and we are a global company. But what does that really mean? What it really means is taking care of the customer at the local level and being sure that you provide the services and taking care of the details of those customers at a local level, and you build up from there.
In this demanding, relentlessly competitive global environment, Intersys delivers more than just batteries and chargers. It delivers total stored energy solutions, built through a combination of resources and expertise that only Intersys can offer. At the front end, a comprehensive design specifically created to match highly demanding performance benchmarks. That design is manufactured on Intersys' world-class production facilities, utilizing the most advanced quality-driven techniques.